Welcome back to Get Your Man On. This is Evan Bass. Hey, let's connect on the socials. Hit me up at TheEBass on Instagram or Twitter. You can hit me at eBass Clinics, where it's a lot of bachelor stuff, but sometimes I get on there. And you can DM me, shoot me a DM on Instagram, shoot me a DM on Twitter, ask some questions that you have for the doctors we have on, the celebrities we have on. We would love to hear from you. Known for his ability to unravel complex men's sexual health issues and chop wood on the weekends like no one has ever seen. Yes, I'm talking about Dr. Tom Alderson, who has joined us again to talk about erectile dysfunction. Doc, let's just jump right into it. Like, what? One of the questions we get all the time is, why have prostate issues? What correlation exists between the prostate and erectile dysfunction?
Well, it depends on whether you have a healthy prostate or a diseased prostate. If you have a healthy prostate that's small and non-obstructing, you're probably never going to have any issues with it. But a prostate that's painful, tender, infected, or enlarged, it's going to cause a compromise to your blood flow and a compromise to your ability to have sex and enjoy it.
That sucks. So what the heck is the prostate? Like, women don't have prostate, right? Can you tell us, like, what does a prostate even, like, isn't it a weird thing? Like, just a bizarrely shaped organ?
Well, I was always taught that the prostate's just an organ that's used to make money. It's really worthless. They really haven't decided or come up with a solution or a reason for having a prostate. The best reason that they think that you have a prostate is to keep you from having infections. Of course, it can be the source of infections also. So it does contribute about 90% of the volume of the ejaculate that men have in their semen. Most people come in and think that most of their semen is made in the testicles, but only about 5 or 10% is contributed by the testicles itself.
Really?
Right.
The prostate produces semen.
Yeah.
That's nuts. Who would have known? That's crazy. So if you get your prostate removed, it's safe to say that your ejaculate would come down. Can I say that? I don't even know if I can say that on the radio.
Well, sure. The ejaculate is basically nothing. You'll usually have no ejaculate after you've had a prostatectomy unless they preserve the bladder neck. The ejaculate is usually retrograde also when you have a surgical procedure on your prostate. It ends up it goes back into your bladder where it's stored until the next time that you void.
Gotcha. So you're not talking about an astrological sign. You know, this is retrograde ejaculation.
No.
In this field, I get targeted with the weirdest ads for the weirdest things because I'm always, researching sex stuff. I'm sure you do too, Doc. I'm always like, oh my gosh. Like, if someone was to look at my search history and all that, they'd think I'm, it's just kind of, like, what today I was like, what is the newest penile erection thing? Anyway, it's crazy.
I think that's probably why Google has the no search button that you can push.
Yeah, I need to go to private or something. Doc, so you've removed some prostates, right?
Several.
Yeah. Like, how many would you say?
Probably 300 or 400 at least. 300
or 400. Oh my gosh. And so back when I first started in this world about 15 years ago, people had prostate removal. They, like, Viagra cells didn't work. No, they couldn't get any erection. Have you seen that change? I know I have. Like, what has been the change, do you think? Or I know you know this, but what is the change in prostate surgery? Like, how has it gotten better, the removal, all that stuff?
Well, when I started, most of the surgical procedures were what you call open, where you have to make an incision in the suprapubic area. And there's a lot of dissection, a lot of trauma to the tissue. But over the past 10 years, there's been a development of laparoscopic procedures where you make small incisions, and they're using robots to do it. So the vision is excellent. There's magnification. There's refinement of tissue. There's, a refinement of the instruments. There's more contact. There's better vision, and it's more precise surgery. So you're not working in a puddle of blood. There's less bleeding. And there's less tissue damage, less collateral damage, I guess you would call it.
Right. So you're trying to preserve. What are you trying to preserve?
Well, you want to preserve the vascular supply to the penis, as well as the neurovascular bundles, which supply the sensation for erections.
Right. So like the blood flow to the penis, which
Correct.
is a big reason why
they're called cavernosal arteries, and they run along the posterior lateral aspect of the prostate. And it used to be we just took the whole prostate out, and with no regards to the vascular supply. But as techniques became more refined, most of the procedures now preserve them and protect them.
Doc, I have a question for you. Asking for a friend, should anybody be administering like a self-prostate exam?
I do that every night.
Asking for a friend.
Oh, it's me.
And the friend is Evan Bass.
Well, that first of all, it seems like it would be difficult to do.
Become quite ambidextrous. I mean, quite flexible.
Well, like if there's a concern, you know what I mean? Like if for anything, I mean, there's reasons to check the old prostate that doctors do, but should people be doing it themselves?
I only know of a couple of people that had issues like this, and that one of the treatments that they used to advocate for people was to massage the prostate, and people would show up in your office, like once a week to have their prostate massage, and you'd see them stick your finger up their rectum and massage the prostate and let them go, and it helped them to empty the volume or the swelling, if you will, of the prostate and get rid of some of the fluid, which would reduce some of the volume of the prostate where they could void better. But
what's the address to that?
What do you mean void better?
Where they could urinate better.
So this was for urinary problems.
This is for urinary issues. Yeah, I just don't understand how you. I remember this one fellow that was one of the older guys in my training program. I can see his face and I can remember his name, but I won't share that with you. But I could hear him in the restroom doing a massage of his prostate before procedures.
What did it sound like?
No.
What do you mean you heard him?
Well, he was moaning and groaning and falling against the wall.
For the pain or for the...
I guess the relief of pain, I guess.
Oh, my gosh. Oh, my gosh. So
he's probably in the grave now, and I'd hate to cast any dispersions.
No, he's rolling over it right now in there. So yeah, that's amazing. So when the prostate's a funny shape, right? Like it's like all like sort of involved in everything, right? Like so that's what causes the problem with urination. Like
normally the size of it is about the size of a walnut, if it will. A normal gland is maybe 20 to 30 grams in size, and when you do a rectal exam, you can estimate the size of it, and if you know the size of it and you know the consistency of normal prostates, and you're able to label the people who have issues with it, for instance, enlargement or nodules that are present in the prostate, which may present as cancers of the prostate.
Mm-hmm. Yeah, I know in the clinics we see sometimes some guys come in and they don't even know that their PSA is increased and they're really high, so we send them out for to get checked on it. But what's do you know like prostate specific antigen, that test? What is that testing?
Well, a PSA is a protein that's manufactured in some of it's mainly 95% of it's manufactured by the prostate, but there are some of the tissues in the surrounding area, seminal vesicles and such as that do produce a small amount of PSA, but it's negligible. When you're looking for PSAs, you're looking for enlargements or elevations of the level above 4,
right?
Usually in men. as you get older, the numbers are increased from 0 to 6 in men over 50 years of age. So, and sometimes even at my age, it's 74, you don't even check PSAs anymore. You know, you roll the dice and you decide, are you going to live long enough to outlive the prostate cancer if you have it, or you're going to get treated early and maybe extend your life 2 to 3 years.
Right. Man.
So,
well, you do not look 74. I can't believe you're going to be 75 this year. It's amazing. When we come back, Dr. Alderson, we're going to talk about testosterone. Get your take on it. Get some stuff. Go to getyourmanon.com to book an appointment at a clinic near you. And no, I'm sorry, they don't do prostate massages there. I'm sorry, I'm just going to get that out of the way right here. But go book an appointment for ED or low T. And we'll see you in a sec. Back with Dr. Alderson coming up.